We became aware of the outbreak in Wuhan very close to the beginning of the year, when it was really an abstract issue in terms of U.S. health. And we decided at that point that we should begin preparation to have an assay available within the University of Washington system in the unlikely event that this virus came to the United States. And at the time, we did consider that an unlikely event. Nevertheless, we began test development at that time, which progressed through the month of January and February. The test was initially rolled out on a research basis because testing was centralized at the time at the Centers for Disease Control and later at state public health labs. Last Saturday, we received go-ahead from the Food and Drug Administration that academic labs such as ourselves could begin to offer clinical testing, and we began clinical testing within University of Washington Medicine Monday morning. The test is currently being run on a daily basis. The laboratory is now operating 24 hours a day with an approximate throughput of 1,000 samples per day. That is currently adequate to meet the demand, and we have plans to ramp that up to levels substantially beyond that should the demand require.
So the current assay we're using is the World Health Organization RT-PCR assay for detection of the COVID-19 virus, SARS coronavirus 2, to detect the RNA. It uses two targets to detect two different genes of the virus. Like he said, we're running tests daily here and with quite a high throughput, and we look forward to be able to contribute to control of this virus in this community.
Developing this test is nothing new for us, and we were very grateful when the change in policy from FDA allowed us to contribute our expertise to the management of this outbreak.
You mentioned that you can meet the demand right now, and if the demand increases, you can ramp up. What is the demand?
We've run about 200 samples, I think, per day, the first couple of days. It seems to be growing. Remember, we've only announced the availability of our test recently, and clearly we don't know the trajectory of the outbreak right now in the local area, but we do expect demand to increase.
When do you anticipate 1,000 tests a day would be a reality?
It's hard to predict the future course, but that can certainly happen within days, I think. And we're working very hard on our top priority, which is increasing our potential throughput in the lab.